Hello everyone and welcome to another case in the series of emergency medicine. Today we will be talking about epistaxis. It is the commonest ENT emergency. So we will discuss about the first aid if the patient develop nosebleed outside the hospital and how we can manage the patient if the patient comes in the hospital. So let us start the case. An adult presented with nosebleed. So what will be your next step? So the first aid is most important. Position, you need to lean the patient slightly forward, and you should avoid lying down or tilting their head back. It's not recommended. Then you need to pinch the soft part of the nose on both sides for at least 10 minutes for adults and 5 minutes for children. But here, if in the ER the patient developed nosebleed, you need to ask him to blow the nose out to put that clot out, and then prepare for the vasoconstrictors like oxymetazoline or phenylephrine. But outside the hospital, you just need to clean the nose out and then pinch the soft part of the nose. Then you need to ask the patient to breathe through their mouth. If you have a cold compression, then you should have an ice pack to forehead, nose, or back of the neck. And you need to use a clean tissue to catch any blood or spit out any blood that collects in your mouth, but you do not need to swallow it. You need to avoid blowing once the nose is been cleaned out, vasoconstrictor being used. You need to avoid blowing or sniffing your nose for at least 15 minutes. And also avoid picking your nose, lifting heavy objects, overexerting yourself, or participating in sports after the bleeding has been stopped. And then you need to check it after 10 minutes and then release the pressure, because you need to have 2 attempts. And then you need to check if the bleeding has stopped. If the bleeding persists, and we need to repeat the steps for at least 30 minutes, but we need to know, because then you need to have a surgical approach to the patient. So always when the patient comes into the ER after the ABCDs, you need to stop all anticoagulant platelet medications. If there is any bleeding, severe bleeding, you need to give IV normal saline. So if the patient develops hypertension, you need to give a normal saline. And for the stop bleeding, you need to give injection transamine 500 mg 1 gram IV stat. And then BID should be given. Injection vitamin K, and if the patient have an infection, you can also give the patient any antibiotics, mostly use ceftriaxone and a PPI. And you need to find the cause. What is the cause? And you need to manage that cause. So it was a short lecture on how to treat epistaxis. Thank you for watching. Please like and subscribe my channel. Thank you.